So we have with us Charity Vasquez. So she's a program director like myself. We're both from the main campus, and she is in charge of our master's degree in child life, which she'll be talking about tonight. Yeah. And we have some exciting things that are happening with that program. Yes. I'm not going to talk a whole lot. I just wanted to introduce you, and thank you for coming back.
Thank you so much. Yay! So glad to be here, and I'm glad this is a little bit of a casual gathering, and so we can all just relax a bit, or at least I can be relaxed a bit and go from there. But as Rob said, I'm the program director for the Master in Child Life, and which is probably something that you've heard of, or not quite, but it's something that I'm really proud to have been in the field for over 20 years for, and I'm going to talk to you guys about that a little bit. But basically, Dr. Eklund couldn't be here today, and she definitely sends her apology, and I'm here doing the spiel here on behalf of her as well, and it's just really thanking Rachel. Where is Rachel? Okay. Like, haven't met Rachel. Rachel and I believe the club members, and also Rancho Demasitas that you guys are partnering with for the toy drive. And definitely that's a great thing, because I myself have always been involved with toy drives when I worked in the hospital. And so working with a lot of children that are in need during that time. And so I really understand and really appreciate the efforts that you guys are partnering with local organization that works to service children and families in time of needs. And so definitely a great thing to be here. I may or may not go fast, but just because it's going to be kind of casual, I want to give you guys time to ask questions too. But first, I want to start off with introduce you to the main campus faculty. They don't know that I'm bringing this picture, but these are all of them right here. And Dr. Eklund, I don't know if you guys haven't met her, but this is her right here. And we have a lot of professors that are with, that comes from different background and different degree focus and research. And so we're definitely glad to be part of this here. And some of the other things that I want to talk about actually is also what we offer. So we have a Bachelor of Arts and BS degree, which is something that you're familiar with. But one of the things that we want to also mention is the fact that within the BA and BS program, we have opportunities for regional campuses too. And one of them is, sorry, Paul. Yeah. So for BA, I'm not sure if anyone has talked to you, but these are some of the areas that you could go into. And one of the things, the track is, if you're interested in child life, working with children, that's the area that you'll want to focus on, and then taking classes. And we have classes that you can take as a senior status from the grad level. And when you apply for a grad program, hopefully you guys are going to apply for grad school with us, and that will be opportunities. And then the same thing with BS, which is the next slide. Same thing, if you have a specific interest in research and science, specific related grad programs, that will be a good track for you and a good focus for you. We also have, within our Department of Psychology, we have three masters. One is actually going to start in the fall, which I'm really excited about to share with you guys. But one of them is I'm kind of going ahead a bit, but the study abroad. Let me talk about the study abroad first. So study abroad is also a program that is available for regional campuses too. There is opportunities for Spain and Estonia and South Africa. And actually, a couple of years ago, Dr. Eklund and I took 10 students to South Africa, and we spent some time at local community partner agency there, and also at the Children's Hospital. So those are also opportunity for regional campus to get involved in. And if you ever want to try abroad opportunity, by all means, definitely try that out. And usually the application is due early November, and it's usually get released around October so that you can apply for it, and then we start planning in January, and then we pretty much are there about 3 weeks, sometime 4 weeks. But it's definitely it's great to be in another area, studying and working with the people there. They're learning culture. We do a lot of culture immersion stuff over there as well. So hopefully you'll look into that. Okay, so there's that. There's that. So the master's program. So we have our master's in research, psychology, and data analysis, Master of Science in Child Life. And our newest master that we're starting in fall 2019 is Master of Science in Counseling Psychology with emphasis in children and adolescents. And it's actually, definitely a field that is directly, if you're interested in working with children, that's the major that I would really recommend you looking into as well. So next slide. So basically, this is our Master of Science in research. So it's pretty much just preparing you for if you want to go into a PhD program or if you want to do research focus. This is the major that's good for you to look towards. And then there are classes that count towards your graduate too as a senior standing if you're eligible for that. The next one is Master of Science in Child Life, and this is something that I can talk forever about. Forever and ever. It's definitely is a specialized field working with children in the healthcare setting in trauma and stress that healthcare experiences brought to children and families. And so our main focus is helping them cope in the hospital setting. And so the master program prepares you to not only the coursework prepares you towards eligibility to take the exam to become a certified child life specialist, but obviously a lot more opportunity with that as well. But this is also another field that's directly working with children. And it could be in the healthcare setting or it could be beyond, but it's definitely is an area that I have a lot of information on. So, and the other one is our Master of Science in Counseling Psychology. And this is actually, if you want to pursue your license as a professional, LPCC, licensed professional clinical counselor. I'm like oh. Yeah. So this is something that we're starting fairly new. A lot of the times people want to work with children. And oftentimes when you are wanting to work with children, you are trained to be a generalist and then you do emphasis in children later on. But this one, you are directly taking courses that are going to be applicable towards children right away. And so this is definitely is the coursework itself, the master itself is going to prepare you towards taking your license and so that you can become LPCC and work with children and families in many contexts. And some of our child life specialists who are at the bachelor level can even take courses from here and then end up with dual masters as well. Or it's a complementary field in any setting. So LPCC works in school setting and trauma settings and family practice everywhere. Yep. So yeah, so definitely I brought, we have information session coming up in January. I brought flyers so that if you guys want to have it later on, you can. And I brought information for child life as well. And usually I bring my little, my zoo animals, but I didn't get to bring it this time. It would have been perfect fitting for a special little guest out there. But I'll have to send stuff to have here, actually. Awesome. Yeah, that would be, I'll have to have some here. Okay, so with that said, one of the things that, I'm here to talk about children, but like I said, a lot of the stuff that I'm going to be talking about is coming from my child life context. But, just here as a whole, I wanted to just address some of the things that children and family experience, and especially, as you're working and partnering with Rancho de Masitas, and they're advocate for foster systems, and having worked with children and family who's come from abusive environment and domestic violence situation. I wanted to just kind of share some not so fun fact with you, and I'm sure it's familiar information, but let's look at it together. So basically, every year more than 3 million children are neglected or abused. Every year more than 3.6 million referrals are made to child protection agency involving more than 6.6 million children, meaning 1 in 6 experience serious injury. More than 150,000 are sexually abused. Researchers believe 50 to 60% goes unreported too. The U.S. has one of the worst records among industrialized nations, losing on average between 4 and 7 children daily to child abuse and neglect. A report of child abuse is made every 10 seconds, and in 2014, an estimated 702,000 victims of child maltreatment. So if you combine them, they fill up about 10 football field. If you guys know what a football field, how big that is, right? Right now, our department is doing fantasy football, so I'm in the football kick right now, and I'm losing to the T, so not happy about that one. But and then more fun fact, not so fun facts is, so of course, any type of stressful situation that children and family go through, it has an effect on their health outcomes. And so, the adverse childhood experiences, I'm sure it's been discussed in some of your psychology classes before, but it definitely is a continuing research out there on how it affects how adverse childhood experiences had really affected adult outcomes, and school performances to even early deaths and other health outcomes. And so it's a continuing concerns and issue. Mental health issue as well. So obviously you are aware that there's a lot of, I want to make sure that I'm here too, so it's like, obviously substance abuse, early use of substances, depression, suicide attempts. And I, having worked in the hospital setting, I have worked, unfortunately, with a lot of teens that has gone through a lot of suicide attempts and abuse and, substance abuse and various types of mental health disorders. And those are serious concerns out there. And so this is also why having LPCC program that we're going to definitely start, it's going to be a good avenue for really addressing the mental health needs of children and youth that are out there. Also, definitely sexual reproductive health issues and risk factors, financial impacts are out there. And so there was an example that talks about in 2008, there were new cases that were coming in, and when they were putting together all the expenditure between health and all the other expenses related to new cases that are reported, it comes up to about $124 billion. So that's a lot of expense right there. And child abuse fatalities. In 2014, 1,580 children died as a result of abuse and neglect. More than 70% of children who died were 2 years of age or younger, and more than 80% were not yet old enough for kindergarten. So one of the areas that I actually worked when I was doing direct patient care in the hospital setting is the child abuse unit. So this information really, it brings up memories, and it's because a lot of the children that I ended up with are under 5 years old, and I myself have lost toddlers to abuse that are severe for many cases, and it definitely is eye opener for how at risk our kids are in the society, even though there's a lot of prevention going on. But this is also why you're here, to continue to do a lot of prevention and education. So. Behavioral health and crime related, and of course, substance abuse and child maltreatment are linked. Children are at risk and 9 times more likely to become involved in criminal activity. And those are some facts that you are already aware of, and so just kind of wanted to bring that up there. And abused children shows high instance of personal social problems and psychosocial disorders. Again, going back to the mental health component. Stress on the brain, memories. They remember these things. And even infants and toddlers have memories of things that they go through that are stressful and that are traumatic for them. And so definitely important to really remember that, and as we know in developmentally, back in the days, they always say, oh, children don't remember things. But, that's why it used to be where infants and, when they're going through circumcision, anesthesia was not used, because the idea is that they're not going to remember all these traumatic experiences. But later on, they did find out that, hey, yeah, there are some memories related to that. And then the other healthcare factor is approximately 20% of all children and adolescents in the United States are diagnosed with serious medical conditions each year. And in 2009 alone, California reported that approximately 1 million children experienced significant health impairments, medical trauma, threats to long-term well-being, and the potential for death and loss affect a significant portion of children and families in California. So, this is one of the important things to remember, because I've always been in healthcare setting, and one of the things that we wanted to always advocate for is those individuals who work in healthcare setting to help children and family navigate the environment itself, because, there is stressful factors in school setting, right? There's stressful factors in early interventions that children and family, and then there's also healthcare setting as well. And Dr. Eklund and I actually, use efforts to submit proposals through legislation to mandate child life services to be in every healthcare settings. And so it did pass, and but it was in appropriation committee meetings and things like that. And so when money talks, people shut down. But anyway, our efforts made a dent of it exposed a lot of people, a lot of the legislation about what child life is and what they do in the healthcare setting. So it was very important for us to be out there representing APU in that end. Foster care. Infants are 20% of children in foster care system. Many have experienced abuse, neglect, and uterine exposure to drugs, or alcohol, violence, and sexual abuse, premature, low birth weight, and serious health and developmental problems, which is something that you're aware as well. But, again, infants and toddlers are a vulnerable population, and they're the most targeted because of their lack of understanding, lack of being able to communicate with the adults, and adults not understanding them as much. And I myself has a huge passion for infants and toddlers, because a lot of the time when people talk about intervention, it always starts with preschooler. My thing is, no, it starts with 0. So I even started doing research around the importance of preparing even infants and toddlers for medical procedures. And it's significant and it's huge to be able to do that. If you think about all the developmental theories and how everything comes to play, that first 3 years is really important for them to be successful as they go on through their childhood. Mental health. These are some other additional research. Mental health issues in children and adults are increasingly points to the realization that many of the adult mental health issues expressed in the United States today are rooted in poorly treated or untreated mental health concerns in childhood. And it's a persistent problem in the U.S. culture among children and youth in the United States, and 46.3 are diagnosed with psychiatric disorders. And so, again, it starts really early. You got to start early. And, okay, what then? This is where we all come in. The idea is for us to do prevention, and early intervention is going to be important, because for children with mental health concern, receiving effective treatment is essential. And a lot of the times there are a lot of children and youth that fall through the crack, right? They don't quite meet this or quite meet that. And then not only that, what we're also finding is in the healthcare system, when children with chronic condition transition from pediatric to adult care, it doesn't really transfer well. The transition itself is, it's not taken as seriously. Now all of a sudden they're adults, they can take care of themselves. And now here is our, individual youth with chronic condition entering college as an emerging adult. And then they go to college, and oftentimes they don't disclose themselves as having a special healthcare needs. And so their academic success suffers as well. And so it just continues on. And that this is actually one of my interests right now to start doing research is around adolescent going into college, but adolescent with chronic condition. And as you know, having experienced pediatric services all along, and now nothing as a young adult, emerging adult, and now going to college, what that all looks like for them. And so that's to be continued on finding. But of course, the other thing is advocacy is going to be really important, you know, as you graduate, and especially in going, leaving APU with psychology. The hope is that you're going to continue on to doing grad school and doing other type of advocacy work so that you can lead change, because it's a partnership that's going to need to continue to happen. It's that collaboration amongst all of us, because what we really want to do is definitely support resiliency in these children, right? Whether if they're in healthcare setting or mental health setting or other crisis setting, they definitely need our our support and our commitment to them in order for them to become a productive member of society. So then, in anything that you do, you're always going to want to consider development. I'm really huge on development, so I want to make sure that I like that. Always development. Oftentimes, we even have to, like in the hospital setting, educate other medical professionals on how to, approach a child developmentally appropriately, so that you're not scaring the heck out of them, or you're, being inappropriate. So a lot of it comes to that too. So. Because children belong to a systems that, if you remember ecological context of human development, they belong in a system where everything affects them directly or indirectly. So it's going to be really important that, we know where we come to play with that. Oh, that's the next. Okay, so child life. So with child life, so like I said, my experience has been mostly in the hospital setting. I've done a lot of trauma work with like the fire victims and the flood victims and all of that. I'm a certified volunteer for child disaster relief. So every time there is this type of disaster that are out there, I get called to deploy. And so whenever I can go, I go. But again, it's, those are some areas that I'm really passionate about. And in healthcare, we unfortunately get to work with children and families that are going through all kinds of crisis and trauma and negative experiences that affects them. And so, and in child life, what do they do? How many of you guys have heard of child life before? Oh, good, because then I can really tell you about it. So, child life, we could go to the next slide, are allied healthcare professionals that works to address psychosocial needs of children and families, really. We are pretty much the liaison in the medical setting between the medical professional and the families. And how many of you guys have been to a hospital before? How do you like it?
Outstanding experience.
Yeah, exactly. And with sarcasm right there, right? Yeah, exactly. It's not fun for adults, and it's definitely not fun for children. It's scary. And anytime a white coat walks into the room, children are going to want to turn away, right? And so that is our job, is to help them cope in the hospital setting by helping them understand what the hospital environment is about, preparing them for procedures and surgery in their developmentally appropriate language so that they understand it. Because oftentimes children will think of, so medical professional, for example, will say stuff like, you're going to have a CAT scan. What do you think a 3-year-old think what a CAT scan is? Cats, right? So we're there to explain to them what a CAT scan is, or IV, or, oh, there are medical jargons like, we're going to put you to the floor. That means they're going to actually be moved to another unit that's less intensive. But for a child, it's like, but I want to be on the bed. Why am I going to go on the floor? So it was one of those things. So we become that person that helps them explain things. We accompany them to procedures and surgeries, and it's just as traumatic itself. And so, having been there, they are even not using sedation when child life is there. And it's been working really well. In fact, they've done a lot of study where in radiation, even radiology, Child Life has saved the hospital so much money per year as a result of not having to use sedation. You know, grief is also another area that we work. We prepare children for the impending death of their loved ones, siblings maybe, or a parent. And so that's another area as well. And so in the, you know, we're pretty much psychosocial part of nursing that's there. And so this is just a lot of blurb, but basically it's education, preparing, assessments, supporting parents and families, and then, you know, advocating for them when it comes to policies, when it comes to advocating to make sure that the physician is you know, is not forcing the situation when a child is not comfortable, is, you know, stopping them to say, hey, let's take a break. This is too traumatizing for them right now. You know, they can't handle this procedure. So we're there for that as well, and resources. So this is a bunch of pictures of what we do. Diagnosis education. We teach children and families about cancer, cystic fibrosis, ulcerative colitis, diabetes, you know, anything that comes at surgery preparation, and patient accompaniment. We go to OR with the patients until they're out in a special sleep. Position for comfort. We advocate for that because a lot of the time when a toddler is wrapped like a burrito for a procedure, that's actually more traumatizing than the actual procedure itself because they lose that control. And a toddler, we know that they want control. So, but sibling intervention, we do a lot of preparation, procedure support, and diversions to lessen stress and anxiety. And so a lot of that medical environment that we do. But, you know, another area that we're expanding is we're also out in hospice. We're out in palliative care area. We use the skill set about child life that we learned in any setting. Early intervention is an area that where they're trauma setting, like I mentioned. Some people have their own private little practice as well, and or support groups. It's many contexts that we're at as far as child life goes. So then the next slide, your role. So how many of you guys you know which part of psychology area you're going into yet? Yeah.
Social work.
Social work. Okay, great.
Forensic.
Forensic psychology, great. Anyone?
Maybe addiction.
Maybe addiction, okay. Or child, absolutely. Yes, I actually did for a few years, I worked as a child life specialist in alternate setting, and I actually go to residential substance homes and work with the parents on how to not only do child development teaching, but also playing with their child for attachment. And so I've done that too. Yeah. Anyone else?
I'm thinking about maybe IO psychology.
Okay, great. Still figuring out, well, whatever you do, is it going to serve children? If it is, you know, why? But even if it isn't going to serve children, definitely you want to think about, you know, your role and where it fits into child life, psychology itself, and where how you can make a difference that impacts children and families, because psychology is broad. You can make an impact in any way, whether it doesn't have to be directly with children. Remember, the ecological system, indirect things that happens in the environment really affects them too. So, be thinking about those things. And then I don't have anything else, but the rest of them are resources on where I got all my, here is Nelson Mandela quote. I forgot about that one.
It's a good one.
It's a good one. So when we went to South Africa, we got to visit Robben Island and really got to know about the history of South Africa. And this definitely is one of my favorite quote. And he's definitely a leader that led change that happened in South Africa. So, he said, there can be no keener revelation of a society soul than the way in which it treats its children. And then, of course, we got to have Dr. Seuss. You're off to great places. Today's your day. Your mountain is waiting, so get on your way. And then there's other ones. But, here you are. You're studying psychology. You're going to many places. So make your dream happen. Any questions you guys may have for me? I kind of, threw a bunch of stuff in one thing. So, no questions?
This is really interesting because it's something that I never considered, especially in a hospital setting, and it's something that I would like to do.
Yeah.
I love working with children.
Yeah.
I feel like they're so much easier than adults.
Oh, absolutely.
And so just the thought of, I was so torn about going into psychology because I didn't want to hear about the traumatic side of it. So this is something that could actually be beneficial.
Yeah, absolutely. There is the traumatic side that you're going to hear, but then you also get to feel the reward of your role in that traumatic setting.
Yeah,
yes.
Really
yeah, and, in the hospital, really, you work with a child who is diagnosed since birth or who was diagnosed later on in life to abuse situation, to a burn victim situation. So it's all in one in the hospital setting. Yeah.
What is I know you're talking, you said child life, and there's a lot of terms kind of thrown around something a little bit.
That's okay.
What is your actual degree in?
So you can get your degree in child life.
Okay, so it's just called child life.
Child life, yeah.
And you can enter what specific? I guess I'm saying what specific positions, or is it kind of just feed into a lot? Or?
So basically, there are people who go into child life from psychology field and child development and family studies, but there are specific coursework that you need to have to work as a certified child life specialist. Just like, when you're going through board licensing, there are requirements that you're supposed to do with internship and practicum hours. Child life is the same thing. You get your degree in child psychology related, but you also have to, within that, you need to make sure that you meet the coursework that the national certification organization requires. And you have to do practicum and internship and things like that and take the exam. But APU has our Master in Child Life, and I'm the program director for it. So, you just have to talk to me. Yeah, so, but there are only 4 schools in California that has a child life specific degree program. And so we're one of them. And so, but you can definitely get that too. It's just that if you're going to specifically child life or a grad program, you have more of a chance of getting into internship more so.
So, how do you differ as a child life specialist from a social worker working with children, from a counselor working with children?
Okay, so in the hospital, we work closely with LCSW a lot, and so they work with parents more and provide that resource. And sometimes they'll work with teens, but a lot of the times, not every social worker are comfortable with working with younger children than teens. And that's what we've been finding. And so we become the other group of medical professionals that works with children from NICU, neonatal area, all the way to teens. And so, but we do a lot more psychosocial clinical education. They do more of case management in the hospital setting, finding resources for parents and family. The child? Yeah, absolutely. Either at bedside or when we're going to procedures with them, we're going to be right next to them the entire time. But we also have conversation with them, do some type of counseling with them at bedside about just really maximizing their coping by having them talk about the stressors the hospital brings or their diagnosis brings.
So then are you credentialed as a counselor with children, or do you have to add that on if you want to do it?
So you get credential as a certified child life specialist. Yeah, yeah. But LPCC that we were talking about, it's, it'll broaden your scope too. But, not everybody can work in the hospital setting. And so, but there's that. But hospital, it's home to me. So you'll love it. I'm recruiting, huh?
Would you thank Professor Vasquez? Again, just to summarize, what an incredible gift it is to have her here to be able to bring to light a master's program that is available right here at our university. So you guys have the opportunity through this gift from your psychology club to bring her in so that you get a glimpse of what options you have after your bachelor's degree, which is wonderful. So already you got somebody who's sold and ready to get signed up ASAP.
Yay!
But that's a glimpse of all the different programs. Again, the idea is to be able to help you have as much information as you need so you can make an informed decision before you finish your bachelor's degree and start applying to master's programs here at APU, especially because, again, we have a lot of incredible options for you guys. What I love about the Child Life program, especially, I mean, it is a hot topic. It is a need in California, especially, dramatic need in California. And again, to think that you could work in the hospitals when people, if you think about it, when people are really at their worst, when their family is in medical need. And so to be able to be there in that moment, bedside, it's a gift, really is a gift. So.